Well,
Awesome.
hello, everybody. So welcome to the Healthy Joints, Healthy Lifestyle Show. My name is Dr. Arinola Dada, for those who don't know me, and I help people with joint pain become pain-free, and people with autoimmune disease get their immune system back on track. I have a treat for you today. This is Dr. Eyitope Roberts. Dr.
Okay.
Roberts was my classmate like 20, is it 30 years, 20-something years ago?
Almost 30.
But I know we're not going to date each other here, okay?
No.
But Dr. Roberts was one of the smartest, and that was a tough class. Dr. Roberts, one of the smartest ladies smartest people, forget ladies, in that class. So, we're going to be well entertained, but she is just full of nuggets and nuggets of seriously important information. So between University of Lagos in Nigeria, some 20-something years ago, and now being a clinical lecturer at University of Calgary, I am going to let the phenomenal Dr. Eyitope Roberts introduce herself to our viewers.
Thank you so much, Dr. Henry, for this opportunity. And hey, every single lady in that class, including you, we were all smart. And that's why we're here breaking barriers and doing so much and giving back. I always look with excitement at all your postings on LinkedIn and the patient testimonials. Thanks for all you do for giving us better joints, healthier joints. Right. So you can call me Dr. T, which is just my stage name. That's what everybody calls me. And yes, I'm a family physician, and we've been doing this for over 20 years, just like you mentioned, all the way from University of Lagos, Nigeria, to the UK, where I did a bit of my postgraduate studies, and now I'm in North America. And yes, we just have a few nuggets to give out to those out there. We're going to keep it simple, just so our patients can understand. We're not going to be too technical here, and hopefully we can carry everyone along and address any questions they may have. Thanks for having me on the show.
Thank you for coming. I'm excited. I think we're going to have a wonderful time. It is so wonderful. You can't even imagine just the bond we have together from going through University of Lagos Medical School together.
Yes,
and, I feel like, I think our motto is, if you survive and thrive at University of Lagos Medical School, you can survive and thrive anywhere.
Just anywhere. You bet.
Anywhere
Absolutely.
in the world, right?
Absolutely.
Okay, so
that was an awesome class. Go ahead.
Yeah. So our topic for today, we're going to talk about postmenopausal bleeding, right?
Okay.
And so we'll start with that. And then the other one is something that Eyitope and I are actually going through called empty nesting. So we're going to start with postmenopausal bleeding. So questions, right? What is postmenopausal bleeding, right? So that people are, our audience is even aware.
Sure. So postmenopausal bleeding is any vaginal bleeding that occurs after the menopause. And we have to be really careful as to how we define the menopause. The menopause, physiologically, that means when it's just your natural body occurrence, is what happens when you have not had a period for 12 consecutive months. And that's if you haven't had surgery, and if you're not on any medication or undergoing any treatment that could make you stop your period. So if you haven't had a period for 12 months, that has not been as a result of medication or surgery, you are in the menopause. Therefore, any bleeding that occurs after that 12 months is what we call postmenopausal bleeding.
Yeah, that makes sense. So, and so then what do we, so, and you can imagine that a lot of women kind of getting into menopause, when they have that postmenopausal bleeding, how much of it should they kind of assume is just, maybe my period is trying to come back, to, perhaps we have a problem, right?
Absolutely.
So,
yeah. And that was why I went ahead to actually define what menopause is, because leading up to the menopause is something called the perimenopause. So that usually would occur on average from your mid-40s to your early 50s. And what tends to happen is that the periods start to become irregular. So they become unpredictable. The flow becomes quite unpredictable. Sometimes it's heavy, sometimes it's light, some women may begin to experience certain symptoms that we group under the big topic vasomotor symptoms, and that's the hot sweats and the hot flushes and the night sweats that a lot of women get. So that is perimenopause. You can still bleed during the perimenopause, and that's normal. However, if you've not had a period for 12 months, that means you are in the menopause and you bleed. You must get that checked out. It's not your period trying to come back. Most of the time, if you've got just a slight spotting and you get cleared by your doctor, you're all good. However, if you have like a full-on bleed, you must see a doctor, because it could be a highlight or a marker of something more sinister going on. So don't ignore any type of bleeding, whether it's mild bleed, whether it's a full-on period. Always get it checked out, just so we don't miss sinister stuff like cancer.
And so with that, we're going to go to the next question is, what is the sinister stuff? Or maybe we start with the what's the less sinister stuff to what's the more sinister stuff.
Right. So let's start with the less sinister stuff. As we know, as we should know, with the menopause, what really happens is that the level of circulating estrogen, which is the female hormone that helps us to get our periods or cycles, gives us nice skin, well lubricated vagina and private areas, that tends to decline once we hit the menopause. And therefore, there will be changes all over our body. I call it the head to toe changes of the menopause. But since we're focusing on the female reproductive organs, we're going to talk about what happens around the vagina and the cervix and, the private area in menopause. What happens because of the decline in the level of circulating estrogen is that the lining of the vagina gets very thin, and because it's thin, it gets very uncomfortable when you have intimacy with your partner, and you could have bleeding as a result of that. Just because the lining is a lot thinner, it's not as thick as it used to be, it's not well lubricated. If you do have intimacy with your partner, then you could have a bit of bleeding or spotting as a result. So it could just be that, a condition we call vaginitis. Sometimes women could also get an infection like a candida infection, a yeast infection. That could cause a lot of itching, and it could cause a bit of spotting or bleeding even after the menopause. Some women may use panty liners or, feminine hygiene products that may cause irritation down below and cause a bit of bleeding. So all of that, if it occurs after the menopause, may be nothing. However, what I do not want is a woman assuming that, oh, it must just be a yeast infection, I should just go get some canestin. With this bleeding, I'm sure it's nothing to worry about. I would say always get it checked out with your primary care provider, especially if you've gone if you are sure that you are in menopause. So that's really important. That's the first thing. So those will be the less sinister things. So just bleeding from trauma, bleeding from a yeast infection or any kind of vaginal infection, bleeding because there's an allergic reaction to a female feminine product that you're using. It could be a panty liner, whatever it is. It could even be your panties, your underwear that's causing that irritation and subsequent bleeding. Certain dermatological or skin conditions could also cause a bit of bleeding down there. So those are things to consider as the non-sinister one. The more sinister problem has to do with uterine cancer. And, the C word, we don't want that guy around us. So after the menopause, if you have any bleeding, it could be an indicator of cancer. And that cancer could either be the cancer of the lining of the uterus, which is endometrial cancer, or it could even be cancer of the cervix or the entry into the uterus, what we call the neck of the womb. If there's an abnormal growth there, that can also bleed. So if you do notice any, I always say, never take it for granted that it's nothing. Always get it checked.
What are the recommendations, actually, as you mentioned? Thank you. That's so helpful. So I mean, the bad players here are, basically cancer, right?
Yep,
and
absolutely.
whether it's the endometrium, inner lining or the outside. And so when you mentioned cervix, Just wondering now what the recommendations are actually for pap smears, right?
Oh,
Because
yeah.
it's kind of
Okay,
all
Doc,
over the
let's bring
place,
that on.
right?
Now, the recommendations vary. So I'll talk about what obtains where I'm practicing. So usually we recommend that women after the age of 25, in some places it's 21. So you need to find out what the local guideline is for you. And what we tend to do is screen by using doing the pap smear or the Papa Nicolau stain. And what that does, we scrape a few cells lining the cervix, we look at it under the microscope, and we go, oh, these are great cells, they're fine. And the benefit of doing the pap is we start to see on time if those cells are changing, because those changes could eventually lead to cancer if they're not dealt with. Now, back to the screening. So it does vary. So we do it in North America every 3 years.
Yeah.
For as long as we need to. And usually that will be up until the mid-60s. When I worked in the UK, it was every 3 years for patients, I think less than, I think it was the mid-50s. And after that, it became every 5 years. So the guideline varies from place to place. This is what we do where I practice. But the cool thing is, I know a lot of health authorities have standard recommendations for screening, and they would actually reach out to ladies and women to say, hey, your pap test is due, you should get it done. So please, if you get such notices, you should definitely get your pap screening done. The pap test is not diagnostic. It doesn't tell us whether or, except the cancer is really advanced, it's a screening test. It helps us to detect abnormalities early so that we can deal with it before it becomes more sinister. So that's the guideline.
Yeah. So I think it's the same. I think the United States, task force, I think it's every 3 years for pap smears, 21 to 65. But I know that there was one time that people were doing it annually. So I think it may vary. But I guess that the maximum interval should be every 3 years then.
Yeah, absolutely.
Yeah, and then they do check for the HPV virus, right?
Yep.
In addition to, yes. And then I think after a certain age, then it becomes every 5. I don't know what
every
it is
5 in the UK.
Menopausal, though. Right.
Even if you're menopausal, you should still get your pap test done once you have the cervix.
Is it the same? And it's the same frequency?
It's the same frequency.
Okay,
there is no
good
difference.
To know. Yeah. Because I think women start to feel that if they're no longer sexually active, which they should be, but if they kind of start to feel that if they're not sexually active, they're out of the woods.
Not necessarily. We still recommend pap tests to be done. Okay. Absolutely.
Okay. Good. So that's a nice note to on uterine bleeding. So one is obviously we want to avoid the C word, and so if you do have bleeding, we want to get it checked out. And pap smears can be helpful for cervical cancer screening. Do we know any risk factors for endometrium, for the bleeding from the endometrium?
So I think the biggest one, of course, will be the use of hormone replacement, especially when you use unopposed estrogen replacement. And, I always tell my patients this these days, because people can fly to Mexico, they can go to South America and get a lot of things over the counter and say, oh, my friend said this is good. You really need to be careful, because even when we replace the estrogen that is very, very low in the menopause, we always balance it out with what we call the progesterone in patients that still have their uterus in place. That's because unopposed estrogen stimulation, whether you're taking the pills, you're using a patch, you're using a gel, is not safe. So we need to always give some protection to ladies to prevent endometrial cancer. Family history, of course, can be another important risk factor there for endometrial carcinoma. So yes, those are some of the genetic. Smoking, of course, we want people to have a healthy lifestyle and try and cut back or quit smoking if they can. It's good for your pocket, it's good for your uterus too.
Yeah. It's funny. Yeah, I had a patient one time who I was talking to her about medications for arthritis, and she told me that she didn't want to take any medications because she was worried about the side effects. But I said, but I see you're smoking, and she's like, oh well, I don't want to add.
As if that's bad enough.
Let's talk about how we can cut down on that smoking. So we started a smoking cessation plan. We'll start by cutting down on the number of cigarettes that you're smoking, right? So if we're going to be concerned about health, let's take it seriously, right? So we kind of walk through a plan of cutting down on our cigarettes because, again, like you said, endometrial cancer is among all the other cancers that it causes, you know.
Sure.
So I think kind of it's a good note in that some of this is preventable, right? And then it's sticking time saves 9.
Absolutely.
And so thank you for that. And so we're gonna switch. We're gonna switch.
No problems. Let's do it.
Okay, we're gonna switch to emptiness syndrome.
Oh.
Tell me, what is that? I've been suffering with that syndrome without even knowing that I had a syndrome. Tell me about it.
Right. So emptiness syndrome is actually a word we all talk about, you know, as parents with children, our children spend a lot of time with us. And then we find that by the time they're going to college, they're saying, bye, mom, bye, daddy, there's a dad around. And, you know, they carry on and they live their lives. And as parents, we feel that void. And that big void, I say, is almost like a potpourri of different emotions. Because one, you're a bit anxious for your children. You feel sad that they've left. You wonder how they're going to cope. You're happy that they're making progress. So it's just a potpourri of a lot of emotions there. And the key thing is, what do we do about it? So emptiness just means your kids have left. It's just you and your partner, or you by yourself in your big house with all their rooms. You miss the mess, you miss the noise, you miss you miss you miss everything about them. So that's just, and you know, there are good parts to the emptiness syndrome. I'm sure we'll get to that. So kids have left home, you're all by yourself, and find what we're gonna do about it.
Yeah. It's, you know, they never really tell you that once you've had kids, they have your heart forever, right?
No, really.
They have your heart forever, right? So it doesn't matter, you know, however old they are, you always kind of worry about them, wonder about them, wonder what they're doing, if they're doing okay, you know.
Absolutely.
So how do people cope? Are there really any coping strategies? And I think for us, right, being away from home being, you know, Nigeria is where both of us come from.
Sure.
But, you know, a lot of people are immigrants and the world is, you know, and even if you were kind of, even people born in the United States, a lot of them have moved to a different coast. And so they're still far away from kind of the high school, college students that they, you know, places, you know, that support, that all gets dispersed. And so there is a little bit, I think, of societal loneliness, right? I mean, and of course, as you get older, it's not as easy to make those deep connections as it was once when we were all like carefree and fancy free.
Absolutely.
So question is, so how do people cope? Any thoughts about, you know, how people can cope with emptiness?
Right. Sure. There are a lot of things that you can do, and I don't think we need to wait till we become empty nesters before we start coping. We need to realize and recognize that as our children get older and more independent, we need to stop the flying around them and trying to do everything for them. In fact, you would agree with me, Aaron, that children nowadays are so fiercely independent. They can get the information they need. They can, you know, they can go where they want. They can drive earlier than I didn't start driving till after medical school, Aaron, you know. So, and my kid was sitting behind the steering at 14, you know. So they have some degree of independence. And I think even before they leave home, as parents, we need to also start to live our lives outside of our kids and ensure that everything about us is not just about the kids and about the kids and about the kids. And I must say, as an African and as a Nigerian, usually that's the case most of the time, because I remembered my late mom of blessed memory will still tell me in my 30s, like, oh, have you had a shower? Have you had a meal? I say, Mom, I'm 30. And she goes, you're still my daughter, my baby, you know. So you need to find that independence even before the kids leave the house, because if you do that, then even though you will miss them, you have a lot of other things to fall back on. And that could be individualized for different people. I mean, I don't know what your hobbies are. I know what my hobbies are. So I might decide, look, I want to connect more. I want to pick up a sport. I want to hang out with friends, well, the right kind of friends. I want to, I want to take a course. I want to write a book, whatever that is for you. I think it's something we need to start thinking about even before the kids leave the house.
Yeah, I think I was forced to do that. I totally agree, with that, and especially kind of with the African, parental parents that we emulated, right, to train our kids. Really was really all in, right, and I think because my kids, my younger kid was actually much more independent, very fiercely independent.
Oh wow!
As so she, more or less, once she learns to drive, she was really eager to learn to drive. And when she learned to drive, she's like, bye, mom. I'm like, who said you could go? So she's very fiercely independent. And so that kind of helped me along a little bit, I think. But she's like, I got it. So it was like, okay, well, then, so things like, I have a book club, joining certain things like Rotary is kind of my thing right now. And finding ways to give back. I actually just joined a math tutoring
nice.
group at a Rotary. My children would laugh. They'd be like, she found someone. she found some kids out there to tutor math. So I think finding outlets and kind of rediscovering ourselves as mom is exactly what you're saying. And so I totally feel that, and hoping that because that's part of your health. And if you don't, I think what Dr. Roberts is also saying is that we need to take charge of that, right? Just don't, it's gonna come. So start being proactive is what Dr. Roberts is saying. Figuring out if it's a sport thing or what socializing things you want to. Dr. Roberts wrote a book. Don't you have a book, Dr. Roberts?
Oh, yes, I do. I have a book.
Please tell us.
It was COVID made me do that, though. I'd always wanted to write about my life story, and COVID gave me that opportunity because we were all in the lockdown. There was nowhere to go. My patients I had to see virtually. So I just spent time writing a story, my life story, really, starting from very humble beginnings to, training to becoming a doctor, my training, my challenges, people always feel, doctors have everything all put together. We don't always, do we? I raised my daughter as a single mom and, just sharing the challenges and the story and how I navigated that. And basically, it's just a good resource for any single mom out there, or if a single mom, even a single dad, because there I shared a lot of tips on how I coped and how I did well, and being a proud mother of a 23-year-old beautiful lady.
So it's an Amazon. And they are doing, I heard your kids are doing fantastic though. Her book, so I've read that, it's quite the inspiration, right?
Thank you.
And there are a lot of women out there who need to see that, on the other side of that, you can thrive, you can be happy, you can be successful,
Absolutely.
you can, so thank you so much for sharing. And would you mind sharing the name of the book so that our audience
Sure. It is called, it's called Still I Rise, a story of 3 generations of victorious African women. So if you go on Amazon, it's there.
We're actually going to put the link at the bottom of this video on Amazon. So I think our audience would really love to kind of hear the story of Dr. T.
Absolutely. Wow. And how I thrived through it. And I think another message for moms out there when it comes to or parents out there is to actually trust our children. Trust them, because at the end of the day, what you have put in these children, the discipline, all that you've given unto them. You just need to trust them to thrive. And the other thing to note is that when they are stuck, they would always come back to you. So even though they've left, just like you said, your heart is always still with them. And, you know, when push really comes to shove, I don't want to use any, say when SHIT hits the fan, they will come back home to your warm, loving hands. And so I want us to trust our kids and to be respectful of them and their spaces. I know it can be a little difficult for those of us from Africa and West Africa, Nigeria, because I couldn't even have imagined leaving home at 17 or 18. It was just, I mean, Henry, I'm sure you'd agree with me. We always went back home. We only left when we got married.
Yeah.
And then we cried and we were back the next day to say hi to mom and dad.
Or they were at the gates knocking. Hi, anybody home?
Anybody home without invitation? We can't do that these days. We need to ask and find what
Don't try. Don't try it, you'll be surprised. So on that lovely note, thank you so much, Dr. T. So I wanted to say, so we have social media links for Dr. T. How can people find you? You know, there are people that are interested in maybe working with you, reading your books, following you. What's the best way for people to find you?
Right. So yes, I am on social media as Chats with Dr. T. My name is Dr. T Roberts. I'm on Instagram. I'm on Facebook. I'm on LinkedIn. And my passion really, which actually made me write my book, is to be in a place to encourage women, is to be in a place to help women become the best versions of themselves, to help women know that they don't have to look like what they've been through. You know, I don't know if you've seen this on social media, Aaron, where they've shown a beautiful lady and at the back, she had so many scars of what she's been through. So what you're looking at is just, you know, the beautiful face all put together, the nice office, us talking to patients and all, but we want women, we know that women have struggles. Even as a physician, I've had my struggles. So my passion is to help that woman out there to know that you can thrive through whatever struggles or problems you pass through in life. And I do bring out nuggets every single month. This month I talked about brokenness, you know, when situations make you feel so broken, how you can come out of brokenness and how you can thrive through brokenness. And in March, I'm going to be talking about self-perseverance. So look out for that. And just there's just so much out there for you. And every Friday, I pick a health topic that I talk about to encourage a woman out there. So yeah, Dr. T Roberts, look for me. I'm there.
Thank you so very much.
You're
I will
welcome.
be, I think, a member. Everyone that listens to this is definitely going to be following you because you have so much to give. Really appreciate the fact that you're putting yourself out there so that people can actually benefit from, because you know we all have this, you know, the public smiles, right?
Facade.
Yeah, the facade, right? So sometimes people look at your Facebook pictures and they're like, oh, this person's life is so amazing. But they didn't show yesterday night, right? There's no picture of yesterday evening, right? Of everything that was going on in their lives. Yeah. So just kind of, you know, it's nice kind of for people to actually just be encouraged that, hey, you know, while you're going through it here, as long as you're taking steps in the right direction, then that's the sum of your future direction. So thank you so much for everything that you're doing.
You're welcome. Thank you.
We're going to put all the links below. Thank you, Patsy.